in the first 4 to 6 months of life, babies should ideally be getting only mother's breast milk. However, often because of medical reasons or because of jobs, mothers are not able to exclusively breastfeed their babies. Mothers that are relatively well off can afford infant formula milk, or they can store the expressed breast milk in the fridges for their baby. But what about the rural poor mother who has to work in the field? These mothers cannot afford the infant formula milk and do not have reliable electricity or fridges where they might store the expressed breast milk. Unfortunately, there is no guideline in modern medicine for these poor mothers about what should they feed their baby. This results in many of these babies getting feeds like tea, water, diluted milk, etc., which leads to chronic malnutrition in these babies. We will soon be starting a research study to find the best feeding option for the babies if their mothers are unable to exclusively breastfeed them for any genuine reason, and if formula or expressed breast milk is not a practical option. We think this question is a critical one to answer if we are to reduce the burden of chronic malnutrition in our children in Pakistan.